You've described the global COVID response, I'll quote you here, as the biggest public health fiasco in history. Feels like a big statement to make. Tell me more.
Well, I think it is, and without doubt, there are two sort of aspects of that. One is, while anybody can get infected by COVID, there's more than 1,000-fold difference in the risk for death and the mortality risk between the oldest and the youngest. So with the naive belief that these lockdowns will protect everybody, which obviously we know now they didn't work. A lot of people got COVID, a lot of people died. But there was this naive belief that they will protect the older people. And because of that, we did not implement basic public health measures to actually do what was necessary to protect those older, high-risk people. And because of that, many of them died unnecessarily from COVID. The other aspect of it is the collateral damage from these lockdowns. So, for example, children who didn't go to schools. The children are at minuscule risk from this disease in terms of mortality. They can get infected for sure, but the risk from COVID for children is less than the risk from the annual influenza, which is already very low for children. So for them, this is not a risky thing. And one example is Sweden. From the first wave in the spring of 2020, Sweden was the only Western country that did not close down all the schools. So schools and daycare were open for children ages 1 to 15. And among the 1.8 million children in Sweden during this first wave, there were exactly 0 deaths from COVID. And that was without using masks, without social distancing, and without any testing. If a child was sick, they were told to stay home, that was it. So this is not a serious disease for children, which we should be very grateful for. Also, young adults have very low risk for mortality from COVID. But the collateral damage has been enormous from these lockdowns. Cardiovascular disease outcomes, heart disease and so on, has been bad during this pandemic because people don't go to the hospitals or there's not available the healthcare that they need. Diabetes patients, for example. Cancer have actually gone down in 2020 and 21, but that's not because there's less cancer, it's just that we're not detecting them. And if we're not detecting them, we're not treating them either. And this is nothing that shows up in the statistics this year, except to a very small extent. But let's say women who didn't get the cervical cancer screening might now die 3 or 4 years from now instead of living another 15, 20 years. So this collateral damage on public health from these lockdowns is something that we're going to have to live with and die with for many, many years to come, unfortunately. And then, of course, there's the mental health aspects, which has been enormous, tragic. So this has really been an awful response to the pandemic, and that goes against the basic principles of public health that we have followed for many decades. So it's very unfortunate, I think.
Well, okay, so that's very interesting. You would think that the basic principles of public health would be implemented, I guess, in force in this sort of a situation. So how has that not been done?
That is a very good question. To be honest, I don't know the answer to it, because to me it's stunning as a public health scientist that we suddenly threw out these principles that we have sort of used for decades to deal with public health issues. One is public health is about all health outcomes. It's not just about one disease like COVID. You can't just focus on COVID and then ignore everything else. That goes against how we do public health. Another thing is we have to look at it long-term and not just short-term. People were obsessed with the mortality for a particular month, comparing countries and so on. But what's important is not the count for a particular month, it's sort of long-term overall mortality during the whole pandemic until it's over. Another thing is public health is about everybody in society. And with these lockdowns, we have protected the Zoom class who can work from home. People like you, journalists, people like me, scientists, but also bankers, attorneys, and so on. while those who prepare food, people in supermarkets, in meat factories, people who actually have electricity, and so on, they have had to work. So the burden has been put on the middle class and the working class, and of course the burden has also put on children who needs education. That has long-term consequences if you don't give children the proper education, and schools are very, very important. And for rich people, they can put their kids in a private school, or they can hire a tutor, or they can afford to have one parent at home to homeschool them. That's not possible among those less affluent. So the working class children has been especially hard hit by this response to the pandemic.
Well, so, we've been hearing a lot about the Delta variant, a lot of scary, frankly, headlines about the Delta variant. Maybe we're going to need to go back into lockdowns in the US. You've described some of the collateral damage, some of the issues. What do you think about this discussion that's happening now?
Well, for any virus, there are going to be mutations, so there are going to be variants. And some variants will be more successful than other variants in sort of spreading among the population. So therefore, it's not surprising that you have variants and that some variants will take over. So this is not at all surprising. The Delta variant might be somewhat more contagious, but that's not the game changer. What would be a game changer is if you got a variant that started to kill young people, so started to kill children. And the Delta variant is not doing that. What would also be unfortunate is if you have a variant so that the natural immunity that you have from COVID or from vaccine doesn't work with the variant. But we know that if you've had COVID, you have very good immunity, not only for the same variant, but also for other variants, and even for other types of sort of cross immunity to other types of coronaviruses. So we know, for example, that if you had COVID-19, SARS-CoV-2, you also have immunity to SARS-CoV-1, which we had earlier, a few years ago. And it also provides protective immunity to the other 4 common coronaviruses that are endemic, that we've all been exposed to, and we will continue to be exposed to. So I don't see any problem with the Delta variants or any other variants that sort of changes anything. It's not a game changer. And the best approach is to make sure that all old people get vaccinated to protect them. And then we should not have lockdowns. We should let people live their normal lives. And if there are an old person who hasn't been vaccinated, they should get it and then wait 2 weeks. And after 2 weeks after vaccinations, they are protected and they can also participate in society. But until they are vaccinated, of course, old people need to be very careful. As long as people are asymptomatic or mildly symptomatic, this is nothing we should worry about. So what we do have to worry about is the mortality and also hospitalizations. The benefit of being immune, whether it's because you had COVID or because you're vaccinated, is not to avoid being infected and test positive. That's going to happen. The key thing is if you have had COVID already or if you are vaccinated, that protects you against severe disease and mortality and death. And we can see that cases and mortality has sort of started to decouple now. So for example, in the UK, there was a wave that peaked in about mid-July of cases. It was a very sharp increase and now it's going sharply down. For mortality, it's just a tiny blip. So this is a contrast to before the vaccines, before focused protection, when cases rose and then mortality also rose, sort of in parallel. But that has sort of been the vaccines and the immunity from people who have had COVID is sort of decoupling that. We can see it in Sweden, which had the first wave and the second wave. There were increasing cases and there was also an increase in mortality corresponding to that. But then there was a third wave that peaked in April. It was a third wave of cases, but mortality kept just going down. and it now has been close to zero for more than a month. So also there was a decoupling, and that was actually the Delta variant that was the third wave. That was predominantly the Delta variant was increasing proportion of those in the third wave of those cases. So, but it decoupled the cases and death. And we see the same thing here in the US now in the summer wave that we see in the southern state. There has been quite a few increasing cases, but the mortality, there's a blip because not everybody is vaccinated, not everybody has had the disease, so not everybody is immune, so there's a little bit of a blip. But we don't see the same close correspondence between cases and death as we've done in the past. So that's a very positive thing and a very good thing.